Scapular elevation for trapezius upper fibers. Grade 5 normal and grade 4 good. Position of the patient, sharp sitting over end or side of the table. Hand relaxed on the lap. Position of the therapist. Stand behind the patient. Hands contour over top of both shoulders to give resistance in downward direction. Test. Before testing, check patient for scapular asymmetry as well as for differences in bulk and height. This is asymmetry in common and can be caused by carrying purses or briefcase habitually on one side. Patient elevates or shrugs the shoulder. Test is must always performed on both sides simultaneously. Instruction to the patient. Shrug your shoulders or raise your shoulders toward the ears. Hold it, don't let me push it down. Grading. Grade 5 normal. Patient shrugs the shoulders for available range of motion and holds against maximum resistance. Grade 4 good. Patient shrugs the shoulder against strong to moderate resistance. The shoulder muscle may give at the end point. Grade 3 fair. Position of the patient and therapist. Same as those of grade 5 and grade 4 except no resistance is given. Test. Patient elevates shoulders through range of motion. Instruction to the patient. Raise your shoulder towards your ear or shrug your shoulder. Grading for grade 3 fair. Elevate shoulders through range of motion but no resistance. Grade 2 and grade 1 and grade 0. Position of the patient. Prone or supine, fully supported on table. If prone, head is turned to one side. If supine, head is in neutral position. Position of the therapist. Stand at the side of the patient. Support the shoulder in palm of one hand. The other hand is palpates the upper trapezius near the insertion above the clavicle. A second set for palpations the upper trapezius just inches into the cervical vertebrae. Test. With the therapist supporting the shoulder, the patient elevates the shoulder. Instruction to the patient. Raise your shoulder towards your ear. Grading. Grade 2 poor. Patient completes full range of motion or partial range of motion in gravity eliminated position. Grade 1 trace. Upper trapezius fiber can be palpated with a clavicle or neck. For grade 0, no palpable activity or movements. Scapular band abduction. Trapezius lower fibers. Grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient. Prone with arms overhead to about 145 degrees of abduction. Forearm is in mid-position with the thumb pointing toward the ceiling. Head may be turned to either side for comfort. Position of the therapist. Stand at his side. Hand giving resistance is contoured over the distal humerus just above the elbow. For a less rigorous test, resistance will be given over the axillary border of the scapula. Fingertips of the opposite hand palpates below the spine of the scapula and across the thoracic vertebrae, following the muscle as it curves down to the lower thoracic vertebrae. Test. Patient raises arm from the table to at least ear level and holds it strongly against it. Instruction to the patient. Raise your arm from the table as high as possible. Hold it, don't let me push it down. Grading. Grade 5 normal. Completes available range of motion and holds it against maximum resistance. Grade 4 good. Takes strong to moderate resistance with full ROM. Grade 3 fair. Takes procedures is used but partially tolerates no manual resistance. Grade 2 poor, grade 1 trace, and grade 0. Position of the patient same for grade 5 to 3. Position of therapist, stand at the side, support the patient with elbow. Test. Patient attempts to lift arm from the table. If the patient is unable to lift the arm because of a weak posterior or middle deltoid, the examiner should lift and support the weight of the arm. Instruction to the patient. Try to lift your arm from the table past your ear. Grading. Grade 2 poor. Completes full scapular range of motion without the weight of the arm. Grade 2 trace. Contractile activity can be palpated in the triangular area between the root of the spine of the scapula and lower thoracic vertebrae. That is the course of the fiber of the lower trapezius. Grade 0. No palpable contractile and any visible motion. Scapular abduction and upward rotation for serratus anterior muscle. Grade 5 normal and grade 4 good. Position of patient, all grades. Shirt sitting over end of side table. Hands on lap. Position of therapist. Hand at the side of the patient. Hand giving assistance is in the arm just above the elbow. The other hand uses the web space along the thumb and index finger to palpate the edge of the scapula at the inferior angle and along the vertebral and axillary border. Test. Patient raise arm to approximately 130 degrees of flexion with the elbow extended. The examiner is reminded that the arm can be elevated up to 60 degrees without using the serratus. The scapula should upwardly rotate, glide up, and abduct without winging. Instruction to the patient. Raise your arm forward over your head. Keep your elbow straight. Hold it. Don't let me push it down. For grading, grade 5 normal. Scapula maintained its abducted and rotated position against maximal resistance, given in the arm and above the elbow in a downward direction. Grade 4 good. Scapular muscle gives or yields against maximum resistance. Scapula moves in the direction of abduction and downward rotation. Grade 3 fair. Position of therapist, same as for grade 5 and grade 4 test. Test. Patient raises the arm to approximately 130 degrees of flexion with elbow extended. Instruction to the patient. Raise your arm forward above your head. Grading. Grade 3 fair. Scapula moves through full range of motion without winging but can tolerate no resistance other than the weight of the arm. Grade 2 poor. Position of the patient, short sitting with arm flexed above 90 degrees and supported by examiner. Position of the therapist. Standing at the side of the patient, one hand supports the arm at the elbow, maintaining it above the horizontal level. The other hand is placed in the inferior angle of the scapula with the thumb positioned along the axillary border and the fingers along the vertebral border. Test. Therapist monitors the scapular motion by using the light Test. Therapist monitors scapular motion by using a light grasp on the scapula at the inferior angle. Therapist must be sure not to restrict or resist motion. The scapula is observed to detect winging. Instruction to the patient. Hold your arm in this position. Hold it. Let it relax. Grading. Grade 2 poor. If the scapula abducts and rotates upward as the patient attempts to hold the arm in elevated position, the weakness is in the glenohumeral muscle. The serratus is awarded a grade 2. Grade 1 trace and grade 0. Position of the patient. Short sitting with arms forward flexed to above 90 degrees superior, supported by the therapist. Position of the therapist. Standing in front of and slightly to one side of the patient. Support the patient's arm at the elbow, maintaining it above 90 degrees. Use the other hand to palpate the serratus with the tips of the fingers just in front of the inferior angle along the axillary border. Test. Patient attempts to hold the arm in the test position. Instruction to the patient. Try to hold your arms in the position. Grading. For grade 1 trace. Muscle contraction is palpable. Grade 2 0. No contraction or any palpable activities. Shoulder internal rotation, subscapularis, grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient, prone with head turned toward the chested side, shoulders abducted to 90 degrees, with folded towel placed under the distal arm and forearm, hanging vertically over the edge of the table. Short sitting is a common alternative position. Position of therapist, stand at chested side. Test. Patient moves the arms through available ROM of internal rotation, backward and up. Instruction to the patient, move your forearm up and back. Hold it, don't let me push it down. Grading, grade 5 normal, completes available ROM, holds firmly against strong resistance. Shoulder horizontal adduction for pectoralis major muscles. Grade 5 normal and grade 4 good. Position of the patient, supine. Shoulder abducted 90 degrees, elbow flexed to 90 degrees. Position of the therapist, stand at side of the shoulder to be tested. Hand used for resistance is contoured around the forearm just proximal to the wrist. The other hand is used to check the activity of the pectoralis major in the upper aspect of the chest, just medial to the shoulder joint. Test. When the whole muscle is tested, the patient is horizontally abducted and the shoulder shows a available range of motion. Instructions to the patient: move your arm across your chest, hold it, don't let me pull it back. Grading, grade 5 normal, complete range of motion and takes maximal resistance. Grade 4 good, complete range of motion and takes strong to moderate resistance, but muscle exhibits giving at the end of the range. Grade 3 fair, position of the patient, supine shoulder at 90 degrees of abduction and elbow at 90 degrees of flexion. Position of the therapist, same as for grade 5. Test. Patient horizontally adducts extremity across the chest in a straight pattern with no diagonal movement. Grading, grade 3 fair. Patient completes available range of motion in all three tests with no resistance other than the weight of the extremity. Grade 2 poor, grade 1 trace, and grade 0. Position of the patient, supine. Arm is 90 degrees of abduction with elbow flexed 90 degrees. Position of the therapist, stand at side of the shoulder to be tested or behind the sitting patient. When the patient is supine, support the full length of the forearm and hold the limb at the wrist. For both tests, rotate the pectoralis major muscle and the anterior aspect of the chest medial to the shoulder. Test. Patient attempts to horizontally adduct the shoulder. The use of alternate test position in which the arm moves across the table precludes individual testing for the two heads. Instruction to the patient: try to move your arm across your chest. Grading, grade 2 poor. Patient horizontally adducts shoulder in range of motion with the weight of the arm supported by the examiner or by the table. Grade 1 trace, palpable contractile activity. Grade 0, no contractile activity. Shoulder flexion, frontier deltoid supraspinatus and coracobrachialis. Grade 5 normal and grade 4 good. Position of the patient, short sitting with arms at side, elbow flexed slightly, forearms pronated. Position of the therapist, stand at tested side, hands giving resistance toward over the distal humerus joint just above the elbow. The other hand may stabilize the shoulder. Test. Patient flexes the shoulder 90 degrees with a total rotation or horizontal movement. The scapula should be allowed to abduct and upwardly rotate. The normal ratio of scapula to humeral movement after the first 20 degrees is 2:1. There are 2 degrees of humeral motion for each 1 degree of scapulothoracic motion. Instruction to the patient: raise your arms forward to shoulder height, hold it, don't let me push it down. Grading for grade 5 normal, hold issue 90 degrees against maximum resistance. Grade 4 good, hand position against strong to moderate resistance. Grade 3 fair, position of patient, short sitting with arm at side and elbow flexed slightly. Position of therapist, stand at tested side. Test patient flex above to 90 degrees. Instruction to patient: raise your arm forward at shoulder height. Grading grade 3, complete test range 90 degrees but tolerates no resistance. Grade 2 poor, grade 1 trace, and grade 0. Position of patient: short sitting with arms at side and elbow slightly flexed. Position of therapist: stand at tested side, fingers used to palpate are placed against the rear surface of the deltoid over the shoulder joint. Test. Patient attempts to flex the shoulders 90 degrees. Instruction to patient: try to raise your arm. Grading for grade 2 poor, completes partial range of motion. Grade 1 trace, examiner feels or sees contractile activity in the anterior deltoid, but no motion occurs. Grade 0, no contractile activity. Shoulder external rotation for infraspinatus and teres minor muscles. Grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient: prone with head turned toward the tested side, shoulder abducted to 90 degrees with arm fully supported on table. Forearm hanging vertically over the edge of the table. Place a folded towel under the arm at the edge of the table as if it was a sharp edge. Position of the therapist: stand at tested side at level of the patient's waist. 2 fingers of one hand are used to give resistance at the wrist for grade 5 and 4. The other hand supports the elbow to provide some counter pressure at the end of the range. Test. Patients move forearm upward to range of external rotation. Instruction to the patient: raise your arm to the level of the table, hold it, don't let me push it down. Therapist may need to demonstrate the desired motion. Grading grade 5 normal, completes available range of motion and holds firmly against 2-finger resistance. Grade 4 good, completes available ROM, but the muscle at end range yields to give away. Grade 3 fair, completes available range of motion, but is unable to take any manual resistance. Shoulder extension, latissimus dorsi, teres major, posterior deltoid. Grade 5 normal and grade 4 good. Position of the patient: prone with arms at side and shoulder internally rotated, palms up. Position of the therapist: stand at dead, hands used to resistance is contoured over the posterior arm just above the elbow. Test. Patient raise arm off the table, keeping the elbow straight. Instruction to the patient: lift your arm as high as you can, hold it, don't let me push it down. Grading. Grade 5 normal, completes available range and holds against maximum resistance. Grade 4, completes available range but yields against strong resistance. Grade 3, fair, and grade 2, poor. Position of the patient: prone with head turned to one side, arms at side, chest arm is internally rotated, palms up. Position of the therapist: stand at tested side. Test. Patient raise arm off the table. Instruction to the patient: lift your arm as high as you can. Grade 3 fair, completes range of motion with no manual resistance. Grade 2 completes partial range of motion. Grade 1 and grade 0, position of the patient: prone with arms at side and shoulder internally rotated, palms up. Position of the therapist: stand at test side. Test and instruction to patient: patient attempts to lift arm from the table on request. Grading grade 1 trace, palpable contractile activity in any of the participating muscle but no movement of the shoulder. Grade 0, no contractile response in participating muscles. Shoulder abduction, middle deltoid and supraspinatus. Grade 5 normal and grade 4 good and grade 3 fair. Position of the patient, short sitting with arms at side and elbows slightly flat. Position of the therapist, stand behind the patient, hand giving resistance, is contoured over just above the elbow. Test. Patient abducts the arm to 90 degrees. Instruction to the patient. Lift your arm out to the side of your shoulder level. Hold it, don't let me push it down. Grading. Grade 5 normal. Hold and test position against maximum resistance. Grade 3 good. Holds and test position against strong to moderate downward resistance. Grade 3 fair. Complete range of motion to 20 degrees but no manual resistance. Grade 2 poor. Position of patient, short sitting with arms at side and slightly elbow flexion. Position of the therapist, stand behind the patient to palpate the muscle on the tested side. Palpate the deltoid lateral to the acromial process on the superior aspect of the shoulder. The supraspinatus can be palpated by placing the fingers deep under the trapezius in the supraspinous fossa of the scapula. Test. Patient attempts to abduct the arm. Instruction to the patient. Try to lift your arm out to the side. Grading for grade 2 poor. Completes partial range of motion. Grade 1 case and grade 0. Position of the patient. Short sitting. Position of the therapist. Stand behind and to the side of the patient. Therapist cradle test arm with a shoulder about 90 degrees of abduction, providing limb support at the elbow. Test. Patient tries to maintain the arm in abduction. Instruction to the patient. Try to hold your arm in the position. Grading for grade 1. Palpable or visible contractions of the deltoid with no movement. Grade 0. No contractile activity. Wrist extension. Extensor carpi radialis longus, extensor carpi radialis brevis, extensor carpi ulnaris. Grade 5 normal, Grade 4 good, and Grade 3 fair. Position of patient, short sitting, elbow and forearm are supported on table and forearm is in full pronation. Position of the therapist, sit or stand at a diagonal in front of the patient, support the patient's forearm under the wrist. Test. For the combined test for the 3 wrist extensor muscle, the patient extends the wrist straight up to full available range. Do not permit extension of the fingers. Instruction to the patient. Bring your wrist up, hold it, don't let me push it down. For grade 3, bring your wrist up. Grading. Grade 5 normal, completes full wrist extension. When testing all 3 muscles against maximum resistance, full extension is not required for test of radial and ulnar deviation. Grade 4, good, complete full wrist extension against strong to moderate resistance. Grade 3, fair, completes full range of motion with no resistance. Grade 2, poor, position the patient forearm supported on table in neutral position. Position of the therapist, support the patient's wrist. Test, patient extends the wrist. Instruction to the patient, bend your wrist back. Grading, grade 2, poor, completes full range with gravity eliminated. Grade 1, trace, and grade 0. Position of the patient, hand and forearm supported the table with hand fully pronated. Position of the therapist, support the patient's wrist in extension. The other hand is used for palpation. Use one finger to palpate one muscle in a given test. Test. Patient attempts to extend the wrist. Instruction to the patient, try to bring your wrist back. Grading for grade 1, trace. For any given muscle, there is visible or palpable contractile activity but no wrist motion occurs. Grade 0, no contraction and no motion. Fingers MP flexion, lumbricals, and interossei. Grade 5 normal, grade 4 good, and grade 3 fair. Position the patient short sitting or supine with forearm insupination. Wrist is maintained in neutral. The metacarpophalangeal joint should be fully extended. All interphalangeal joints are flexed. Position the therapist, stabilize the metacarpal proximal to the MP joint. Resistance is given on the palmar surface in the proximal row of the phalanges in direction of the MP extension. Test. Patient simultaneously flexes the MP joint and extends the IP joint. Fingers may be tested separately. Do not allow fingers to curl. They must remain extended. Instruction to the patient. Uncurl your fingers while fixing your knuckles. Hold it. Don't let me straighten your knuckles. For the grading, grade 5 normal. Patient completes simultaneous MP flexion and finger extension and holds against maximum resistance. Grade 4 good. Patient completes full ROM with moderate resistance. Grade 3. Patient completes both motions correctly without resistance. Grade 2 poor, grade 1 trace, and grade 0. Position the patient forearms and wrist in mid position to remove influence of gravity. MP joints are full extended. All IP are flexed. Position the therapist, stabilize metacarpals. Test. Patient attempts to flex MP joint through full available range while extending IP. Instruction to the patient, try to uncurl your fingers while bending your knuckles. Grading for grade 2 poor, completes full ROM in gravity eliminated position. Grade 1 trace. Except in the hand that is markedly atrophied, the lumbricals cannot be palpated. A grade 1 may be awarded for minimal motion. Grade 0. Grade 0 must be given in the absence of any movement. Fingers and extension. Extensor digitorum, extensor indicis, extensor digiti minimi. Grade 5 normal, grade 4 good, and grade 3 fair. Position of the patient, forearm inclination, wrist in neutral, MP joint and IP joint are in relaxed flexion posture. Position of the therapist, stabilize the wrist in neutral. Place the index finger of the resistance hand across the dorsum of all proximal phalanges, chest distal to the MP joint. Test. For the extensor digitorum, patient extends MP joint, all fingers simultaneously allowing IP joint to be in slight flexion. Test for extensor indicis, patient extends MP joint of the index finger. Extensor digiti minimi, patient extends the MP joint of the fifth digit. Instruction to the patient, bend your knuckles back as far as they will go. Grading, grade 5 normal, completes activity extension, range of motion with appropriate level of strong resistance. Grade 4 good, completes active range of motion with some resistance. Grade 3 fair, complete active range of motion with no resistance. Grade 2 poor, grade 1 trace, and grade 0. Procedure, test is the same as for grade 5, 4, and 3. That is the forearm in the mid position. The tendon of the extensor digitorum M equals to 4, the extensor indicis N is equals to 1, and the extensor digiti minimi N is equals to 1 are readily apparent as the dorsum of the hand as they course in the direction of each finger. For the grading, grade 2 poor, completes range of motion. Grade 1 trace, visible tendon activity but no joint motion. Grade 0, no contractile activity.
Fingers, abduction. Dorsal interossei, grade 5 normal and grade 4 good. Position of the patient, forearm pronated, wrist in neutral, finger starts in extension and adduction. MP joints in neutral and avoid hyperextension. Position of the therapist, support the wrist in neutral. The fingers of the other hand are used to give resistance on the distal phalanx of the radial side of one finger and on the ulnar side of the adjacent finger. Test. Abduction of fingers, individually tested. Instruction to the patient. Spread your fingers, hold them, don't let me push them together. Grading, grade 5 normal and grade 4 good. Neither the dorsal anterior side nor the abductor digiti minimi will tolerate much resistance. Grading between 5 and 4 muscle is a judgment call based of any possible comparison with the contralateral side, as well as clinical experience. For grade 3 fair, patient can abduct any given fingers. Remember that the long finger has 2 dorsal anterossi and therefore must be tested as it moves away from the midline in both directions. Grade 2 poor, grade 1 trace, and grade 0. Procedures and grading, same as for higher grades in this case. The grade 3 should be assigned if the patient can complete only a partial range of abduction for any given fingers. The only dorsal anterossi that is readily palpable is the first at the base of the proximal phalanx. The abductor digiti minimi is palpable on the ulnar border of the hand.
Fingers, abduction, ulnar anterossi, grade 5 normal and grade 4 good. Position of the patient, forearm pronated, palms down, wrist in neutral and fingers extended and adducted. MP joints are neutral. Avoid suction. Position of the therapist, the examiner grasps the middle phalanx on each of 2 adjoining fingers. Resistance is given in the direction of abduction. For each finger tested, the examiner is trying to pull the fingers apart. Each finger should be resisted separately. Instruction to the patient. Hold your fingers together, don't let me pull them apart. Grading, grade 5 normal and grade 4 good. These muscles are notoriously weak in the sense that not tolerating much resistance. Distinguishing between grade 5 and 4 is an excessively infertility, and the grade awarded will depend on the amount of the examiner's experience with normal hands. Grade 3 fair. Patient can abduct the fingers towards the middle finger, but cannot hold against resistance. Grade 2 poor, grade 1 trace, and grade 0. Procedure same as for grade 5, 4, and 3. For grade 2, the patient has to abduct each of the fingers tested through a partial range of motion. The test for grade 2 is begun when the fingers abducted. Palpation of the palmar anterossi is rarely feasible by placing the examiner fingers against the side of fingers to the tested. The therapist may detect a slight outward motion for a muscle less than grade 2. Fingers IP and DIP flexion, flexor digitorum superficialis and flexor digitorum profundus. IP test, flexor digitorum superficialis, grade 5 normal, grade 4 good, and grade 3 fair. Position of patient, forearm supinated, wrist in neutral, fingers to be tested in slight flexion at the MP joint. Position of the therapist, hold all fingers. Isolation of the index fingers may not be complete. The other hand is used to resist the head of the middle phalanx of the test fingers in the direction of extension. Steps. Each of the 4 fingers is tested separately. Patient flexes the IP joint without flexing the DIP joint. Do not allow motion of any joints on the under fingers. Instruction to the patient. Bend your index. Fold it, don't let me straighten it. Keep your other fingers relaxed. Reading, grade 5 normal, complete range of motion, and hold it against maximum resistance. Grade 4, complete available ROM against moderate resistance. Grade 3, complete range of motion with no resistance. Grade 2 poor, grade 1 trace, and grade 0. Position of the patient's forearm is in mid position to eliminate the influence of gravity or index flexion. Position of the therapist, same as for grade 5, 4, and 3. Palpate the flexor digitoris proficialis and the palmar surface of the wrist, between the palmaris longus and the flexor carpi ulnaris. Test patient stretches the PIP joint. Instruction of the patient, bend your middle fingers. Grading, grade 2 poor, completes range of motion. Grade 1, trace, palpate, or visible contractility may or may not be accompanied by a flicker of motion. There are no contractile activity. Thumb MP and IP extension, extensor pollicis brevis and extensor pollicis longus. Grade 5 normal to grade 0. Position of patient, forearm in mid position and wrist in neutral, CMC and IP joint of the thumb are relaxed and in slight flexion. The MP joint of the thumb is in abduction and flexion. Position of the therapist. Stabilize the first metacarpal firmly, allowing motion to occur only at the MP joint. Resistance is provided with the other hand on the dorsal surface of the proximal phalanx in the direction of flexion. This is normally strong muscle. Test. Patient extends the MP joint of the thumb while keeping the MP slightly flexed. Instruction to the patient, bring your thumb up so it points toward the ceiling. Don't move the end joint. Hold it and technique push it down. Grading, grade 5 normal and grade 4 good, only B. For the experienced examiner can accurately distinguish between grade 5 and 4. Resistance should be applied carefully and slowly because this is usually a weak muscle. Grade 3 fair, patient moves proximal phalanx to the thumb through full range of extension with little or no resistance. Grade 2 poor, patient moves proximal phalanx through partial range of motion. Grade 1 trace, the tendon of the flexor pollicis brevis is palpated at the base of the first metacarpal where it lies between the tendon of the adductor pollicis and the extensor pollicis longus. Grade 0, no contractile activity or any visible motion.